My name is Dr. Shiver. Nice to meet you. Now, I understand that you are here for a cranial nerve exam. And it says here that you've opted for the procedure to be performed with your eyes closed. Yes, of course we can do that. Yep. Some people find it to be a little less stimulating on the eyes. Okay. Let's get into it. Just put on some gloves. How are you doing? Good. Is there anything that you wanted to bring up before we begin the procedure? Okay. Yeah, okay. If there's anything that is of concern, it should come up in the cranial nerve exam. To begin, I would just like you to close your eyes. So just close your eyes. Close your eyes down. Just close your eyes. Just close your eyes down. Close them. Just close your eyes. You can keep them closed for the entirety of the procedure. Okay. Now I will be just taking a look at my notes so we make sure that we get everything done that needs to be done. Okay? We want to be extremely thorough. So, going to begin with an eye exam. So, this will mean that you'll need to engage your eyes behind the closed lid. Yes. Basically what we're looking for is how well your eyes detect changes in light. So I'm going to be shining a fairly bright light onto your closed eyes. So make sure that they're closed, okay? So I just want you to tell me if you can see a light or any changes in light. No? Okay. Now? Yes, okay, good. Now? Perfect, good. Now? Very good. And now? Very, very good. Now, I need you to differentiate between the two eyes. So if you could take your hand and place the more fleshy palm part up against your eye. Either one is fine. Very good. We'll do that again. Can you see changes in light currently? Apart from your covered up eye? No? Okay. Now? Good. Perfect. Now? Perfect. And now? Very, very good. Okay. Now swapping over to the other eye again, using the fleshy part of your hand. Okay. Do you see any changes of light? Good, okay. Now? Good. And now? Perfect. And now? Excellent. Now, you can just take your hand off your eyes. I'm going to do a light motion test. So, I want you to tell me if the light that is shining onto your eyes, if it is moving, or if it is still. Okay, so moving looks like this. light that moves can cause kind of a flashing sensation, so do be mindful of that. Let's get started. Moving or still? Still, perfect. Moving or still? Moving, perfect. Moving or still? Still, perfect. And moving or still? Moving, very good. Moving or still? Still, perfect. Now, I'm going to move the light from side to side. Could you just track it for me while I do so? You can see the eyes moving underneath the eyelid. I need to assess your eye's ability to stay focused on a point of focus. Does that make sense? Good. Very good. Okay, very good. Now, as I move it from side to side, I want you to count the number of times that it does so, okay? Begin counting now. How many times did the light move? 8 times. Very good. Let's do that again. Begin counting. Now. How many times did the light move? 13 times. Very good. One more. And how many times did the light move? Very, very good. I would now like to just touch around and on top of your eyes. I have gloves on. I do need to come a little bit closer, okay? Okay, so I'm just going to start around the brow bone. I'm just trying to see if there's any signs of irregularities, tension, anything that seems inconsistent. Okay, now to the sides. Good. Okay, and down below, just around the eye socket. Being very delicate around the skin here, I know it is very sensitive. Okay. Now I'm going to press directly onto the closed eyelid. So I'm just going to press, 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 and hold. use one thumb. Okay, no tension. The other thumb. Okay. Okay. Good. That all feels pretty good. Your eyes feel great. Nice and healthy. I'm just going to go and collect some items for the next test. Okay. Okay. I'm going to now move on to a hearing test. Okay. I have a tuning fork here. It sounds like this. I just want you to tell me when you can hear the tuning fork. Okay? Make sure to keep those eyes closed. Good, okay. Which ear do you hear the tuning fork? The left, very good. Okay. Good, okay. And which ear is this? The right, perfect. Okay, good. This time, can you tell me when you can no longer hear it? Good. Again, tell me when you can no longer hear it. Good. Good. Perfect. I'm going to introduce a second tuning fork. I want you to tell me if you can hear one tuning fork or two. Okay? Okay. One or two. One, perfect. One or two. It's two, very good. One or two. Just one, perfect. Just the one. Very good. One or two. Two. Very, very good. One order. Just one. Very, very good. Perfect. Just swapped out the second tuning fork for a higher tuning fork. It sounds like this. I'm going to use the higher tuning fork and the lower one to test your pitch detection. Okay? Okay. Right. High or low? This is the low, very good. Which ear do you hear this in? The left, perfect. Very, very good. High or low? This is the higher one. Which ear do you hear this in? The right, very good. Very, very good. Good, good, good. High or low? This is the higher one. Very, very good. Good, good, good. Which ear did you hear that in? Left, very good. High or low? Not low, very good. And again, which ear can you hear this in? Right, very good. Perfect. Very, very good. I'm going to now whisper some words in each ear. I want you to repeat it back to me. I'll say the word 3 times. Yeah? Okay. Let's do the side. Good. 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 What did you hear? Good, very good. Great. 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 What did you hear? Great. Great. Cake. 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 Okay, good, very good.
Click. Click. Click.
What did you hear? Click, very good.
Relax. Relax. Relax.
What did you hear? Relax, very good.
Syntax. Syntax. Syntax.
What did you hear? Very good.
Pickle. Pickle. Pickle.
What did you hear? Pickle, very good.
Picture. Picture. Picture.
What did you hear? Picture, very good.
Eagle-lick-a-duck. Eagle-lick-a-duck. Eagle-lick-a-duck.
What did you hear? A click duck, very good.
Electric. Electric. Electric.
What did you hear? Electric, very good.
Technical. Technical. Technical.
What did you hear? Technical, very good.
Topical. Topical. Topical.
What did you hear? Topical, very good. I'm going to move on to a test. It is called the click test. I'm going to be using this fidget cube. I'm going to be playing 2 clicks on it. And I want you to tell me if the first click is higher or lower than the second click. This is what the 2 clicks sound like. This is one, and this is the other. Other side. Does that make sense? Okay. So, you ready? Okay. First click. Second click. Higher or lower. So was the first click higher or lower than the second click? First one was higher, very good. Okay. Was the first click higher or lower than the second click? It was lower, very good. Was the first click higher or lower than the second click? Higher, very good. Higher or lower? Perfect.
Higher or lower? Lower, perfect.
Higher or lower? Higher or lower? Lower? Perfect. Did a very good job at that. Well done. Now going to do another hearing test. This one is an object detection test. Okay. Okay. Just keep your eyes closed. Okay. What material or object does this sound like? Okay, one more. Chain, very good. Next sound. What does that sound like? Spray, very good. Spray bottle. Next sound. What does that sound like? Cork. Very good. It's a tricky one. Well done. Just assemble the last one. Last one. What did that sound like? Keyboard. Very good. You did a very good job with that hearing test. I just want to have a look inside your ears with the otoscope. Okay? Is that alright? Good. Start over here on the right. So I'm just going to put the otoscope into the ear and have a look. Do you mind if I ask you a few questions? Okay. Do you put anything inside your ears? Headphones, cotton swabs, anything else? That one looks nice and healthy. Let's take a look at the others. Or the other, rather.
Okay, let me see it here. Okay. Okay, I don't see anything again. Signs of redness or inflammation or excessive earwax buildup. Eardrum is nice and healthy, no signs of perforation at all, which is good. Have you experienced any ringing, difficulty balancing, changes in your ability to hear recently? No, okay. Do you spend a lot of time in water? Swimming, showering? No, okay, good.
Okay. That looks nice and healthy. From what I've examined so far, everything's working great. Okay. Let's now move on to a sensation test. I'm going to be testing the nerves of the skin on your face. So I will involve a little bit of touching. So we'll inform you that I'll be touching it with something soft and fluffy and feathery, and something slightly pointed, but nothing too intense or harsh. Okay. I know your eyes are closed. It comes as a surprise. So I'm going to perform what was known as a sharp or dull test, differentiating between a sharp sensation and a dull sensation. I'm going to be doing this with a fresh, clean ear pick, with a pointed end and a fluffy end. Okay? I'm going to touch your face with either side, and you tell me if it's sharp or dull. Okay. Let's begin.
Sharp or dull? Dull, very good. Sharp or dull? Sharp, very good.
Sharp or dull? Dull, perfect.
Sharp or dull? Sharp, perfect.
Sharp or dull? Dull, excellent.
Sharp or dull? Dull, perfect.
Sharp or dull? Sharp, very good. Now going to just do a zone test. I have a makeup brush in my hand. It's very soft. Just going to swipe it on different zones of the face. Zone 1 is the forehead. Zone 2 is either cheek. Zone 3 is the chin. And zone 4 is the nose. Okay? I want you to tell me where I'm brushing. If you can't remember the zone, just let me know. Okay? Okay.
Where am I brushing? Forehead. Zone 1. Good. Where am I brushing? The nose. Zone 4. Perfect. Very good.
Where am I brushing? Zone 2, the cheeks.
The cheeky cheeks. Cheeky cheeks. Very good. Good.
Where am I brushing? Very good. Zone 3. Perfect.
Where am I brushing? Zone 2, the cheeks. Very good. Good, good, good. Perfect, perfect, perfect.
That's everything I need for the facial sensation test. Let's now do a smell test. I have some tubs here. Inside are very salves or waxes that are perfumed. I'm going to open them. They're sealed well. And waft it beneath your nose. And I want you to tell me what you can smell. Okay? Okay. Okay. Let's take a deep breath in. What can you smell? Raspberry. Very good. Next. Just going to waft that under your nose. You take a deep breath in. What can you smell? Cinnamon. Very good. It's one of my favorites. Good. One more. Take a deep breath in. It's peppermint. Very good. Perfect. Last one. Then nice and deep. That one is pineapple. Very, very good. Mm-hmm. Yes, this air is very sweet and fragrant. Very pleasant. Mm-hmm. So that is the smell test. Now we're going to run a taste test. I have little bottles of essences, and they are each from different flavour groups. So there's typically 5, sometimes 6 flavour groups. You have salty, spicy, sweet, sour, savoury is another one, yeah. Or umami. Yeah. So I'm going to drip this on your tongue. I want you to tell me which flavour group it is, okay? 3 bottles, so lots to choose from. Open your mouth, please. Just stick out your tongue. There you go. What's that? Salty, very good. Next one. Yes, bitter is another one, that's right. Okay. Open your mouth, please. What can you taste? Sour, very good. Last one. Right. Open your mouth, please. Very good. What can you taste? Sweet. Perfect. Very, very good. Is that alright? Good. Okay. That is the end of the cranial nerve exam. Well, from what I've detected today and from what I've examined, everything seems fine. You're welcome to rest here and keep your eyes closed for as long as you need to. So you are the last appointment for the day, so if you need to have a rest, that's perfectly fine. We'll just be here doing paperwork for a few hours more. Alright. Well, you enjoy your rest. Rest assured, everything is fine. Yes. It's wonderful to meet